Welcome to Transcended. I'm Joe, and I'm the dad.
And I'm Raya, and I'm the daughter.
This week, we've got a topic that we felt we ought to address here along the way. We have often questions. Actually, Raya, you have more questions presented to you than I do to me. But there's a lot to talk about here, and we're into the healthcare field today. Full disclosure, Raya works in the healthcare field.
And we'll talk about that in just a moment. So there's a lot to talk about with healthcare. And yes, you and I went to go visit a PFLAG group recently, and we had a conversation with the group there, and some of the questions that came up were, tell us a little bit about healthcare options as a transitioned a trans woman. What kind of options are available for me? And would you feel comfortable talking a little bit about your hormones and how comfortable do you feel talking about and some of those things, and particularly with one person that was really interested for herself because she's at the front end of everything. We were really grateful to be able to have that conversation. Mm-hmm. So we thought, let's talk about that a little bit here right now.
Right. We want to start first with talking about general availability. What is available right now, and what kind of things are kind of general commonplace that people can get treated for, and those kinds of things.
So the first one is going to be hormones. Let's start off with hormones. And of course, hormones is easiest when we're talking about binary trans people. And by that, I mean, we talk about MTF or FTM, meaning that you're transitioning from presenting male to presenting female, or transitioning from presenting female to presenting male. And of course, then, like for me, I started off my journey by taking a testosterone blocker. And interestingly enough, the one that most people will take is spironolactone, which they also will give. I will look this up sometimes for people when they're calling to ask about their health care plan when I'm on the phone with them. It's given for, I believe it's blood pressure. And so not only will it lower, when they talk about, side effects may include, well, one of the side effects of this blood pressure medication is lower testosterone. And so what they do for transgender women is they'll give us more of that, which is generally pretty safe, although they do, it's always medication. So they always have to, constantly be monitoring, and you go back for your blood tests and you see how everything is, and is it creating problems? But assuming that everything goes okay, it should lower your testosterone without having to make any kind of changes or any surgeries.
So how often, when you begin taking that, how often do you go back for this test? Is that every month, or is it once every 6 weeks?
It depends on your provider. And my provider, I think, had me generally doing, once every 3 months to start with for the first year, or maybe even 2 years. And anytime we've made adjustments. But now that everything is good, I think we just do once a year, and the provider says, that's fine. I just want to check your levels and see where everything is.
So am I to interpret by that you have to take this forever?
So for a testosterone blocker, you'll need to take that for as long as you have not had any surgery that would remove your body's own ability to produce testosterone. And there would be at least 2 different surgeries, 2 that I'm aware of, that you could choose. So generally, if you have, quote unquote, the surgery where you have, that usually they'll call that bottom surgery. At that point, your body they've removed the ability for your body to make testosterone.
I see.
But for somebody that doesn't want to have the full surgery, because that can be very scary, even if you maybe want the full surgery, it's also very scary, and it's a very invasive surgery, and lots of trans people, lots of trans women will choose not to do that. And so there's another option that's called an orchiectomy, where they can actually take out of the testicles, they can take out the pieces that produce the testosterone. And once you've had that done, then you no longer need to take a blocker, because your body is not producing it naturally.
So I just have a question. You say that a lot of people are concerned about having that surgery like that, and they're really nervous about it. Are most of those surgeries successful? Is the success rate 50%, 20%,
I don't
80%?
I'll be honest, I'm not up on all of that, but I would say it's very very high from what I have seen.
Yeah.
I'm much more familiar with the rate of regret of surgeries. So I've seen that. And the rate of regret after somebody has had gender affirming surgery is lower than the regret that we see for most other surgeries for things like having a knee replacement or those kinds of things,
Oh,
but
yeah.
and you see a lot of people saying, oh, well, this is causing all of this harm to your body and this and that. Generally, the trans people that go on to have surgeries have thought through at length about whether or not we're very aware. We understand this is going to change our bodies dramatically.
So now we started out here by talking about the testosterone blocker. And is that generally paid for by insurance?
I think yes, usually as long as it's ordered by a doctor. And most of the nice thing is that most of the medications are going to be generics. So spironolactone, if it's
Mm-hmm.
covered by insurance, is not expensive.
Okay.
Oftentimes your insurance may cover it at no cost or that sort of thing as well.
And what other thing
So
then?
then you're looking at adding to your body the hormones that your body doesn't produce naturally. So in the case of a transgender woman, again, you're looking at the primary one is going to be estrogen, and so usually that would be estradiol. Now there's a few ways that people can take that. You can take it as a shot, which I was never excited about and chose never to do. So I can't speak anything to what happens with an estradiol shot. The other way you can do it is as a patch, where it's sort of like the nicotine patch, but it's an estrogen patch, and you put it on your skin somewhere. And I don't know how that one works either because I never did that. The third one is going to be just a pill where you just take it and there's you can do it as transdermal trans I forget what it's called, but you put it under the tongue and then it dissolves. Or there's another formulation of it where you can just take it as a normal pill.
Mm-hmm.
And once your body, and that's the exact same thing as they would give to postmenopausal women that an estrogen replacement where their body is having too much difficulty, where you're having just so much trouble with hot flashes and things. It's going to be the same idea, although usually they will put women that are taking estrogen replacements on a much lower dose than they'll put trans women on.
Okay. So
I
we
would say in that I can actually speak to because I have frequently looked up medications for women that do have replacement, and it seems to be about a quarter of what I take is what I have noticed. An eighth to a quarter of how much I take to replace the full amount. So
mm-hmm.
for whatever that's worth. Then you can also take progesterone. And the verdict is out. Many doctors will say we don't want to give you this, but that is more frequently what will promote breast growth for trans women. And you can get that as a cream, or you can get that as, I think that you can do a pill. And so, yeah, so those are some of the options there. And I don't know a lot. Certainly, I would never recommend taking any of this as medical advice, but this will give you an idea. If you're out there and you're wondering, what should I do? This will at least give you an idea of what to talk to your doctor about. And you can go on. And in fact, when we were there at the meeting, one of the other people there that was asking some of these questions, like, it's been years since I've researched some of these things. I don't even fully remember. I know what I do, and I sort of figured it out for me, and I'm kind of good,
Yeah.
so I would trust more what your doctor says
Mm-hmm.
versus, and then do your own research, because oftentimes we find you have to educate your doctor as well, which we'll get to here in a little bit.
Mm-hmm. Okay. So then, talking about what is available today? Okay, we talk about first of all about some of the drugs, and
Well, so and we talked about transgender women, but if we go talk about transgender men, generally you've just got one option on that. In this one, I don't know nearly as well, other than conversations. But for testosterone, that one you have to do as an injection. And so I've been there with somebody that did, and that's a weekly injection. He did his injection and just grabbed, grabbed on his tummy and then took it and watched. And oh, that was hard for me. I do not like needles at all. But and then they say for the guys that have that, typically they find that first day they can notice the effects of the testosterone, that they're more aggressive and they want to do the thing. They want to go. Whether that's do something really highly athletic, or they might be a little more edgy on those days, or they might be it puts you a little bit elevated, and then it kind of comes down over the course of the week, and then the following week you take again.
and is that true then every week from then on until forever, or?
I think that it is.
Oh.
I think that's my understanding. Yes.
Mm-hmm.
And there again, usually insurance is going to cover that, but we've had a fight. Certainly transgender rights. We've had to fight for coverage for medications and for what doctors will do for us and the kinds of healthcare treatment that we're receiving. We've had to fight quite a bit. Now, thankfully, we've come a long ways. So in 2023, it's much, much better than it was even in 2013, and certainly light years better from how it would have been 20 or 30 or 40 or 50 years ago.
Mm-hmm. Mm-hmm. Okay, so then there's just general health care. We talk about that people need X and Y and Z for various things. What are there any differences in the fact that we're talking about an LGBTQ community as opposed to the cisgender community being treated the same way? How does that work?
Well, there certainly are. To begin with, there's always still at least some discrimination. Now, again, things have gotten much better, and thankfully, I don't feel like I have ever experienced discrimination. When I transitioned, we found a guy. Everybody said, go to this guy about an hour away. He's sort of the transgender community is all going to him. So I said, okay, we're going to go to him. And he was the one that wrote the initial prescriptions for everything. And he just said, I think he just wanted, at that time, I think, a note from my therapist saying, yes, we've gone through, and yes, I'm really transgender. And he said, okay, that's it. And he wrote me the prescription, and that was it.
So you didn't need a note from your parents?
Not at 40 years old, no.
No, that's right.
And then once I had that, then I was able to switch over to just a general practitioner. And now I've actually been through 2 different PCPs. Both of them were nurse practitioners. Both of them said, you're already on the medications. We're just going to keep you on that. We're going to monitor your levels, and that's all that we need to do.
So you get good cooperation is what you're saying.
I have had very good cooperation. Now, I think, too, and this is me feeling like I came into this with a whole lot of privilege, and I've sort of brought in with me the idea that when I go in for healthcare, they're going to give me what I need, and I just kind of assume that that's the case.
Mm-hmm.
And I carry myself that way, and it becomes almost a self-fulfilling prophecy. But it's also very easy for me. Now, would my experience be the same if I was more economically disadvantaged? I'm certain it would not.
Do you think you have any extra clout because you happen to work for an insurance company?
No, I don't think so there, but I think I don't have to worry about the fact that I think a black trans woman in particular is going to have a lot more fight from her doctor than I'm going to have.
Mm-hmm.
I can kind of come in and I just say, look, this is what I need. And right now, I switched over a few years ago. I said, forget it. I don't want to drive an hour anymore. And so I switched over to a local doctor. It's just a nurse practitioner right in town, in our town of 1,200 people. And she's basically, if you want to go get your health care in our small town, you're going to go see her. And I booked an appointment and I said, I would like to have you be my primary care provider. And she said, sure. And I said, I've got some special needs as a transgender person. And she said, yeah, I understand that. And I said, will you continue prescribing my medications? And she said, sure. And that was it. And thankfully it went very, very well. And I do think it was a self-fulfilling prophecy for me. I went in assuming it was going to be good, and it was good. That's not everybody's circumstance, but it's much more likely in 2023 than it would have been in the past.
Would you say that most people would say the current treatment that they receive as a member of the LGBTQ community, would they say normally that it's good or it's bad?
I think there's a lot of fear, rightfully so. Certainly coming from the history. When I talk with a lot of trans women, that's primarily who I'm talking with, although I talk with people all throughout the trans community. And certainly we have history with things. And there are famous stories told about transgender people that, for instance, one transgender woman that had, I believe she had prostate cancer. And or maybe it was the other way around. Maybe she was still marked on their form. I was trying to remember the details and look it up, and I don't recall offhand because this is not a story that I like to dwell on, so I don't remember the details. But whatever it was, the provider said, I think it was actually that she maybe had a problem with needing mammograms and something related to maybe breast cancer, but men can also get breast cancer. So I don't know. I don't remember the details, but it was something where it was a gendered disease, and the healthcare insurance company said, we're not going to pay that for you because however she was marked in the system, either she was still marked as male and so she was not receiving the treatment that most cisgender women would need, or she was marked as female and they wouldn't give her the treatment that she still needed because her body didn't, like you still need prostate screenings.
Well, that sounds pretty complicated to me. So
It is.
I think what you're saying is you really don't know, but you do know there could be issues.
There always are. And that I know for me, it's easiest for me to talk about my scenarios that I said to my doctor, I said, and here's where, I learned some of this as well. I said, okay, well, here's here's what I'm going to need. Here's the surgeries that I have had. Here's the surgeries I have not had. And so I know I'm going to need mammograms, and I know I'm going to need prostate screenings. And she said, oh, yeah, okay, that makes sense. Now, I have a personal principle that I don't talk about even when somebody asks respectfully. Most trans people don't mind talking about what surgeries they've had or not had when they agree to do it. I personally have the principle that I won't talk about it, and the reason is I don't ever want my status, my validity as a trans person, I don't want it to feel like it is based on whether or not I've had the surgery. Mm-hmm. I don't think that somebody having the surgery doesn't make you more legitimate, or not having the surgery doesn't make you any less legitimate. So what I will say, I have no problem saying that I wrestled a lot with what kind of surgery, if any, did I want to have and what my decision was. But I decided beforehand that once I made the decision either to have a surgery or not have a surgery, I was not going to talk about it, because I don't ever want for myself, if I have the surgery, to be tempted to base my validity on the fact that I've had it. Or if I choose not to have it, to feel like I constantly have to be on guard. Does that make... It doesn't matter. That's between me and my doctor and my partner, and that's all. Nobody else needs to know.
And that you hear out here, what she's saying is she's saying that that's her opinion. That's where she stands. That isn't necessarily how everyone feels. You're hearing one side of the story or one interpretation.
As
And
we said before, if you've met one trans person, you've met one trans person.
yes, that's right. So, and we're just sharing those kinds of things, keeping in mind that what we're trying to do is educate you along the way and help you to understand a lot more about where people are and why they are, where they might be going, and where you ought to go if you want to support them.
And you know, and when I was having these conversations with the doctor, I still very much need the doctor. I have to tell the doctor a little bit about my special needs, but then the doctor also has to tell me about the things that I'm ignorant of. And we got to talking about if somebody has had the surgery, regardless of where I came on it, I did, we were talking through and I said, for somebody that has had the surgery, do they need to still do pap tests? And she said, no, because after you've had the surgery, you don't have a cervix. And I said, oh, sure, that makes sense. I never thought about it, but I don't know. So I needed her to educate me, and the two of us together came up with a really good, plan for what does healthcare actually look like? Which is, you have to really trust your provider in order to do that.
Well, I think you just hit on something really critical right there, and that is selecting the right provider. As you say, you have to trust your provider, and I think we probably cannot emphasize that enough.
Absolutely. When I first switched over to a general practitioner, over from this one guy that was, kind of specialized for trans folks, but when I said, I'm just going to go see, get me in with the next provider that can see me, and I chose somebody that my insurance would cover. And the very first time I went in, I had the same conversation, and they come into the room when you're in the exam room beforehand. And before the doctor comes in, or in this case, the nurse practitioner, I was meeting with somebody else beforehand. She's going through and she takes your blood pressure and, they do your pulse and they ask you all of those questions. And then they ask, do you have any specific healthcare questions that you want to talk about with them today? And I said, well, I do need to have you know that I am transgender, and I didn't put that on any of the forms beforehand because I don't really feel comfortable just talking about it. But you are my healthcare provider, so you need to know that right now. And she looked at me, and you could tell this was something new for her, and she hadn't really encountered this at all. And she's, oh, yeah, okay, well, oh, okay, so then are there any specific? And she kind of went through, any specific questions I had, and then she looked at me. And, and I kind of told her a little bit about my story, but you could tell the light still hadn't really gone on. And then she looked at me and she said, so when do you plan to transition then?
Yeah.
And I stopped and I looked at her and I said, what do you mean? And she said, well, when will you transition to become a man? And I said, no, honey. No, I've already transitioned. I'm a transgender woman. Oh, and her eyes got real big.
Well, that's pretty good. It made you feel, that was a confirmation for you that made you feel really good.
It did feel really good. Yes,
Yeah.
It absolutely did. And then when the provider herself actually came in, then she already went through, and I told her right away, and we kind of explained, and she was so good. I think the providers now want to come in. Everybody wants to say, I want to be I want to be good at my job. And being good at my job means I'm not going to harass you for anything. Just like when you and I, many years before I transitioned, we had a transgender woman that worked with us.
Yes, we did.
Long before I recognized that I myself was transgender. And so I didn't think of myself as transgender. And you and I were both, we didn't treat her any differently. We didn't, in our meetings and things, we would never say, oh, well, she's a weird transgender woman, so we're not going to talk to her or treat her ideas as good. She contributed as much as anybody else. Now, Were there implicit biases that we had that we didn't realize? I'm sure that there were.
Mm-hmm.
But
I think so.
in just like with the doctor, are there implicit biases that they may have? I'm sure there are. But in general, in 2023, they want to come in, and you remember what you and I both thought. We thought we want to make sure. We want to make sure that we treat her equitably. We want to make sure that we're fair with her because we're sure that there's legislation out there that would she could use to come against us if we weren't.
I guess so.
Not that we would
Actually,
ever not want to be, but
right. I never really thought about that much because all employees, I think, when we had the company, we tried to treat everybody kind of the
you
same way.
always wanted to. I
Yeah.
think we were especially careful because we didn't want to be perceived as being unfair. We
Right.
were especially careful about that. And come to find out now on the other side of things that actually there were a lot less legal protections for people like me than we wish that there were. But that said, we wanted to be fair. And I think that that's normal. I think healthcare providers want to be fair.
Oh, I think so too.
And so every time I've come into those rooms, I have acted as if they wanted to be fair, and they have treated me as if they wanted to be fair.
Mm-hmm.
And that's been enough. That's been all that we've needed. But that's not the case for everybody.
So, what kind of questions about healthcare do you think that most people would have if they don't have an opportunity to? Maybe they don't even know anyone other than their son or daughter who has considered coming out or something like that, and they're going to have questions. What kind of questions do you think they'll have, and what can we tell them?
Well, there's always the question about long-term effects. And I would love to say that there's no long-term negative effects. But the reality is anytime you're dealing with any medication, there can be side effects. And anytime you're dealing with any kind of surgery, even the most simple of surgeries, there can be effects.
Mm-hmm.
No surgery is 100% safe, and no medication is 100% safe. That said, we've come a long way. And so these things are in the same level of safety, maybe even higher, from a lot of other procedures that we have. So I would say for people that have concerns about safety and concerns about long-term, those sorts of things, that has largely been dealt with. But it's always a conversation. That's why we have doctors and we don't just Google things. It's because you want to have your that conversation with your doctor.
Mm-hmm.
What questions did you have as I was going through? I know you were it's a little different because I was an adult, but I know you still had questions. And
Well, I would have the first thing I would have said is regarding questions is what kind of damage do you think you might be doing to your body right now? You were just taking the hormones and a few other things that I guess that isn't that are you doing something that you shouldn't be doing to your body? Those kinds of things.
Mhm.
I guess that's what I would.
It's a good question, and I don't know that there's an easy answer to that other than what I said, that in general these are safe and they're monitored and they're approved by all of the groups that need to approve them. When I started taking estradiol, they did say if I go for not podiatry, if I go for a pedicure, they will always do a massage of your feet beforehand. And they said you can't get a massage of your feet because you're at a higher risk of blood clots with this.
Oh.
Not dramatically higher, but slightly higher. So we would strongly encourage you, don't do that, because if you had a blood clot and they do that kind of massage on your feet before they do that, that could free a blood clot and that could be very dangerous. So don't get that kind of thing. That was one minor thing. And of course, then other things, there's always the question, which we're not going to address here today, but the questions about how does this apply as you get transgender youth? You're opening a whole different can of worms there, and that's a different discussion for a different day. But other than that, long term, it's, I would say, very similar to, like I said, if you had a knee surgery. You can do some long term, you can have some long lasting effects if you get a knee surgery and it doesn't go well, just like any surgery.
You probably don't know the answer to this, but I'm going to ask you anyway. Is there anything new coming on the horizon that, or some things they're talking about, hoping to develop that are going to make things easier, better?
One that might surprise people. This is not so much new, but one of the surgeries, or a group of surgeries, I should say, that many people will go through is what they call facial feminization surgery. And I imagine it probably exists the other way as well, masculinization surgery, which is, it seems like it might be a new technology, but it's basically just what can you do so that your face looks less like a man? But that's been around actually for a long, long time. Those kinds of things are there. I don't know what new things. I know for transgender men, there's always advances, particularly there. With it's harder when you're having to create a body part, that doesn't exist than it is if you're, if you're
Right.
in a sense taking away or that sort of thing. So, and I don't know as much about that. I know there are options, and it's growing all the time.
Yes, that's right. Yeah, so there's a lot of changes that are being made. So what we talked about just before the podcast is that there have been dramatic advances we since 10 years ago. And that's important to know that things are moving always in a more positive direction for the community. And that's a positive thing. And although that's not necessarily the case with laws, we have some unusual situations in the states and various states that tend to be going backwards, we think, on some of the things. But as far as healthcare goes, there's continued advances and things are moving forward. And you, the conclusion I have here for you is that you feel generally you're getting pretty good treatment, pretty fair treatment, and no concerns.
For me, yes, absolutely. And that is my one opinion as a single person. And I may be in the minority on that. But part of that has been that you and I have always, I learned from you to view the world through the lens of positivity and come into every situation and always assume the best and hope for the best and believe for the best. And I find that tends to be the case. Not always. That tends to be the case.
It tends to be the case more often than not.
Yes.
That's true. I feel the same way. So with that, if you've got any questions, we want to hear from you. And we would like you to form your questions for us, and we will address those on the air as we did a couple of weeks ago. And now with the healthcare area, if there's something you want to know, you send it to us, and we might know the answer, but we might know where to find it out.
We sure do. You can email transdescendant@gmail.com. We always appreciate getting your emails. If you haven't subscribed, take a moment and hit that subscribe button on whichever platform you get your podcasts on. If you don't know which podcast to use, which podcast platform to use, I can tell you I use Spotify, and I think that's a great one on your phone. Otherwise, whichever you prefer is always going to work out well, or you can go to our website. Just do a Google search for Transdescendant, and we will come up.
With that, have a great week.